Eric, I don't know you. So, what campus do you work at?
I'm at Jersey Shore,
What department?
Brennan 6 slash Mahandrew 7.
Okay, welcome.
Thanks.
Caitlin, welcome, and Riva. So, my talk for this morning is on leadership perspective, and so I'm just going to start. When you're the charge nurse, you may deal with staffing. How do you process a team member who got sick in the course of your shift? What's your baseline staffing levels, acuity, things like that? So it is important to just know that being in this course, we don't teach you the specifics of your department because you may have different flow in your department, but we're giving you the tools and the principles so you can be an effective charge nurse. So, a charge nurse is someone who is self directed, calm under pressure, respond to issues in the unit in the absence of your leaders. Um, you are engaged, you have a good relationship with your colleagues, and you're able to see the bigger picture. You're able to demonstrate strong decision making ability, positive attitude. You are viewed as the clinical resource, a role model, and must have effective communication skills. So, what are your patient flow tools? During your shift. So, as you know, you use a unit manager. You may not get involved with that on a given day if you're not a charge nurse, or you're a new nurse perhaps. But the unit manager will help you facilitate communicating. If there's any bed requests, the transfers and discharges, the bed statuses, maximizing efficiency and identify barriers. So, as a charge nurse, you need to know the nuance of the unit manager. If you haven't done so, please get yourself familiarized with the unit manager because that will help you when you become in charge. Um, so, in the unit manager, you're able to assign the appropriate patient to the correct bed. Um, and then things to consider your potential discharges. So, you have to match also a patient with an appropriate patient so you can make necessary adjustments to the assignment. And then consider staffing and patient needs for upcoming shifts. If you have when you look at the staffing, oh, the nurse may have a new nurse or she's precepting someone. That's a consideration also. Um, and there's challenges in balancing the unit needs. So your perception of what your department needs and from other, like the supervisor, they also have a um, a different perception of what needs to happen because they're thinking globally. But you, as the charge nurse for that department, you're thinking about your unit needs. So think about the global need, perhaps in the ED. So the ED can take as many patients as they want, but in your specific department, if you work in Brennan, a five South, five North, you may have just that within 32 bed capacity, you can say we can't accept anymore because our beds are filled. But in the ED, they can't say that, right? And unless they're on divert, but that's another discussion. All right. Understanding the care plan. Uh, so let's say you have a patient that is on CBI, and it's Friday, and the weekend is upcoming. So you want to make sure that all your supplies are in place, your CBI bags, or if you have a new patient that has a new catheter. So you want to make sure that there's enough supplies that you would utilize for your shift. So we have an upcoming downtime. So downtime is always, it's important that you need to review your downtime uh, procedures. So where are your paperwork or any downtime forms? So it's important to connect with your team. You may meet with your team and huddle with the team and say, you know what, we're going to have a downtime today and at this time. So let's make sure that we have everything what we need for when we give meds, just in case we don't have access to the computer. Um, so daily huddles, you can do daily huddles beginning of the shift. You can also do like a mid-shift huddle, or even yet if it's you had a code, you need to huddle with your team to debrief on a difficult situation, difficult code. So it's really important to have that. So there may be some uh, new nurses that's coming on board, or a preceptor or a preceptee that uh, you are working with. So it is important to really connect with them. So our goal as a charge nurse and as the leader in the department is to transition these new nurses from education or from the classroom to practice. So it can be stressful, and sometimes they are assigned new uh, difficult patients, complex patients. So it is important. It's an important consideration for us to really see. Oh, how can we ensure that they are provided the tools that they need during their shift, or they just came off orientation. How can we help them or connect with them? So you may still be a preceptor while doing a charge nurse role. It depends on your department. So the goal is for us to help the new nurses to provide safe and competent care, and take care of the patient independently. So as you know, for the past 2 years, we have had challenges with COVID. There has been emergence of the COVID pandemic back in 2020. And so nurses were overwhelmed. The nursing workforce were overwhelmed, resulting to a great resignation, which impacted all healthcare settings. And, I don't need to reiterate that, but it is a fact. We have seen some travelers, and, they may be still this part of our staffing, or the core staffing in our departments. But um, so we need to make sure that you know we have a good rapport with them and welcome them. I know for some, there's been studies out there that travelers, they often get uh, because of our mindset, or the regular staff's mindset is that, oh, they're getting paid for this uh, assignment. Why should I help them? But you have to remember, they are part of the team now if they're working with you. So we need to make sure that we welcome them and provide the tools that they need when they're in our department. So every health system is looking forward to the class of new graduates, right? However, for the past 2 years, or for the 2 years that had gone by, just remember that some of these new nurses, they may have had very little to no experience in the bed at the bedside, because they did not get clinical experience. Um, some of them got clinicals virtually, so they haven't took care of a patient, touch a patient during that time. So we need to welcome and be a mentor to these new nurses. So some facts, or some statistics, what had happened back in 2020 to the current trends now. So COVID has been a life quake experience for some nurses. So it's a massive life change experience with aftershocks that we may not know, the impact for individual nurses. Experiences of frontline nurses during the pandemic resembled a warlike setting. Also, nurses felt experience feelings of abandonment at work, as well as within their own families and communities. Strategies for addressing feelings of abandonment require nurses and nursing leaders to foster lines of communication and promote safety and wellness at work. So it's important. So we are part of that, the leadership, uh, so we can promote that wellness and promote safety within the workplace. And also, we have seen compassion fatigue, um, and then the mental health of our colleagues that's working with us. So it's really key. So if they are on a break, make sure that they are really taking a break. uh, Assigning uh, nurses when you're in charge to what break, first break, second break. That's usually how we did it in the past, and so that was an effective way of doing it, because you're anticipating when you're gonna take a break. So just think about that, how you will be doing that in your practice. So these are just some statistics. Nurses under 35, 66% feel anxious compared to the 35 of nurses over 55. 47% report feeling depressed, 60% report feeling traumatized by COVID, and 19% feel that their organization cares about their well-being compared to the 42%. So this is more of a global statistic. And the nurses over 55, uh, 60 per, 63% now intend to leave or are considering leaving the organization, versus 30% in other age groups. And some, they're considering where they work, or what they're going to do for the next 5 years. Um, not really within nursing. So the nurses who graduated in the past 2 years, the world was in the middle of a pandemic. Everyone wore PPE, and thankfully, we may have some reprieve in the coming months, but so we don't necessarily see each other's faces. I don't, I may not recognize you when you're wearing your mask. If I go to Jersey Shore and I see Eric, in Jersey Shore, and he's wearing a mask, right? So like I said, last year of nursing school was done remotely using simulation, uh, and the turnover rates among RNs have skyrocketed. So as you can see here on the right side of your screen, this is just the tip of the iceberg, as they call it. So what you see on the surface, that's just what we see now, but we don't really know what's happening with our colleagues. So everyone that comes to work, they may be carrying that burden. Um, so we don't socialize with our colleagues outside of work. So in the past, we used to do that. We feel overwhelmed with all the chaos in the environment. So staff are now reconsidering everything: staying, retiring, work-life balance. So this is some of the things that we're up against. So where does magnet components fall in place with these issues? We have, so as you know, we have the four magnet tenets: transformational leadership, structural empowerment, exemplary professional practice, new knowledge and innovation, and improvement. So as a charge nurse, you have, it's within your purview that, as a charge nurse, you are a transformational leader. So we advocate for you to be a transformational leader within the capacity, within the charge nurse capacity. Structural empowerment: being a certified nurse is a demonstration of your that you are you would like to show forth your expertise as an RN. Also a professional development, uh, and to be recognized as a certified RN. Uh, we still have the goal of making sure that we have our BSN. If our nurses doesn't have a BSN, so we promote that scholarship. And exemplary professional practice, being part of the professional practice council, um, making sure that you're aware of what are nursing sensitive indicators, your falls, your happy, your CLABSI bundle. So being aware of what is your performance improvement projects in your department, that's really key because that all falls into place within, uh, you know, your role as a charge nurse, RN satisfaction, turnover, and all of these things. And then new knowledge and innovation. So if there is anything that you have an issue about, for instance, in Epic, right? You're using Epic and you found a better way of doing things in Epic, so you can, uh, you know, uh, make your leader aware to say, how can we improve our documentation? I found a better way, and sharing that knowledge, being part of research council. So all of these things uh, fall into play within a charge nurse role. And shared decision making model. So part of being uh, a charge nurse, you can get yourself, being part of the unit based council, because that's where your voice come. You know, you have a platform where you can raise concerns and discuss it with your leader, your peers. So, um, you know, bring forth any issues. Being a charge nurse, if you have identified, a better way of making sure that workflow is better, that's your unit-based council is one platform that you can use. All right. So what can we do to keep our nurses as a charge nurse, right? So be a role model, educator, coach, understanding our roles and responsibilities for new nurses that's coming on board. Uh, if you had identified that they are have difficulty with IV insertion, provide that input to your leader so that we can better address their competency. If they're still in orientation, making sure that their goals, the daily goals, are being completed, and fostering critical thinking by providing open-ended questions, having a discussion, providing clinical examples, perhaps debriefing after a rapid response or uh, um, a code, um, just reflection on what had happened for that shift. Um, you have communication discussion later on, so I won't harp on that. But competency evaluation, validation. So if they said, a nurse asks you, "Oh, can you please? I haven't done, blood transfusion," and they're already off orientation, right? So be a mentor to them, and there may be challenges along the way, but uh, you will be a support for those new nurses as well. So I'm just gonna skip this and continue on with some of the items in here. So transfer of information is essential within the preceptorship. Feedback, so providing them that feedback. Feedback should be timely, non-judgmental, and conveyed privately if it's something that it's something that they need it's an opportunity for those new nurses, or even uh, they may be experienced nurses but they haven't received your the way you handle things during when you were a charge nurse. You can convey it to them privately. um, Reinforce and provide constructive criticism. Regularly meeting with these new nurses, if you are precepting, and providing feedback to the preceptor if they're working with a new nurse. Okay, so you may work with difficult people over your role as a charge nurse, but focus on what you can control. Don't overreact, and then set ground rules. Um, Use empathy, talk less and listen more. So you'll have more of that discussion in the communication aspect. Um, so this was already discussed previously. So the takeaway here is we have to improve our culture. They say, nurses eat their young. In my past experience, it happened to me, but we should cultivate a culture that is promoting the um, betterment of our practice. So a toxic culture will destroy the best plan. So we may be the best charge nurse, but if we have a toxic culture, but that will just go away. Even with just one person who may have, who you may not be able to handle that conflict, right? Creating a sense of belongingness, like I said earlier about the travel nurses, or even someone who floats to your department. We need to provide them safety and confidence, and then so it's hard for them to leave us, or our department. All right, the COVID effect. Many teams have lost their rituals, so we may used to have like a get together uh, event in our department, and that went away. So it's important to cultivate that back, to make stronger teams and improving teamwork in our uh, department. Encouraging friendships on the unit. They said that if you have a friend or a best friend at work, most likely they won't leave because you have a connection. So when you go home, so as a church nurse, you may be you may have had the stressful shift, but so take a moment to think about what happened, reflect, acknowledging one thing that was difficult on the shift, and let it go. Consider three things that went well. So that really, that it's a great reflection on what are the things that went well and maybe some opportunities. Check on your colleagues. How are you? Are you okay? So, if it was a difficult code, check in on them, right? Um, and then switch your attention to going home and rest and recharge. And that's really key in being resilient. So, in summary, as a charge nurse, you will take on a different role. You may have fears or preconceived ideas of what a charge nurse should be, but understanding the charge nurse role, knowing your resources, who you can call, and effectively communicate with your peers, um, it would be helpful. So, we may have new nurses on board. So it is important to be a mentor to them to help them transition to practice and utilize your magnet principles, transformational leadership, structural empowerment, new knowledge and innovation and improvement, exemplar professional practice in your role as a charge nurse. Know that your leaders are fully supporting you in your professional development. So if you have any questions, let your leaders know. Um, so support your preceptors as well, and provide timely feedback. That's all I have. Thank you for your attention. Do you have any questions?
No, thank you, Juvie.
Thank